Now, what age should a parent, and most of the practice is centered in this around children, correct? I mean,
the idea behind using the fact that we're growing individuals, and the most rapid growth obviously is when we're young.
Yeah.
Whenever a parent has a question about what's going on with their child with regard to their teeth, the way they look, the way they're coming in, the way they're working together, that's the time to come in. Because we offer a free consultation.
Sure.
We really enjoy the idea behind educating our parents and the patients that come in. And that comes from the background that I had as a teacher.
Mm-hmm.
I think our most important function as a professional in the community is to educate the community the way we've been educated and about the things that we know best. So when is it the most important time? When you have a question. The next thing is kind of like what the age range, when the questions start to come. And that is when the changeover from baby teeth to adult teeth occur. And that's in the 6 or 7 year range. So the American Association of Orthodontists looks to, in their recommendation, to have a visit with the orthodontist by age 7.
And that doesn't necessarily mean they're going to get work at that time.
Mm-hmm.
There's a lot of things that we look for. The easiest way to put it is a bite that's even and stable is something that we wouldn't necessarily treat. But if there is something going on where, say, an upper tooth would be on the inside of a lower tooth, or the lower jaw would be shifting from one side to the other because the bite isn't correct, those are issues that are very treatable at the 6 to 7 year old range. Patients are very, very compliant at that range. They're usually relatively simple fixes to get the growth to continue in the straight and ideal direction. When we look at what the specialty of orthodontics involves, it's the study of jaw bone growth and tooth development. So what they call dentofacial orthopedics is what we deal with mostly at that age, getting the jaws to align themselves correctly so that the rest of the baby teeth can fall out between, say, 10 and 13, and that would be the range that we really truly begin to do a full set of braces and orthodontics.